It is my great privilege and honor to present this year's inaugural Distinguished Advocacy Service Award to Joan and Tim Block and the Hepatitis B Foundation. Hepatitis B Foundation, celebrating its 30-year anniversary in 2021, is founded on the mission to find a cure and improve the quality of life for those affected by hepatitis B worldwide through research, education, and patient advocacy. HBF was founded in 1991 by Tim and Joan Block with their friends, Paul and Janine Whitty. It's actually a personal story behind the founding of Hepatitis B Foundation. Joan, who is a HBV carrier, was suspended from her job as a nurse, and her child was kicked out of daycare. This injustice has ignited the decade-long crusade of Joan and Tim to advocate for the prevention and cure of this infection. Not too many organizations can tout the involvement of two Nobel laureates. Dr. Baruch Blumberg joined HB Foundation in 1992 until his death in 2011. Dr. Harvey Alter joined the Scientific Advisory Board in 2000 and continues to serve. HBV Foundation is a global patient portal. Its website receives 4 million unique visits from more than 100 countries each year. The website has a very active physician directory for patients both in the U.S., internationally, updated lists for new drugs and clinical trials in HBV, in 14 translated languages, among many other features. HBF Outreach Program empowers patients. The hashtag JustB National Storytelling Project was designed to put a personal face on this disease and to empower patients to share their stories to decrease stigma and discrimination. Hep B United was started by HBV Foundation to coordinate and organize all the different groups across the country working on community-based HBV programs. This national coalition is working to become a significant advocacy voice in Washington, D.C. Each year since 2012, HBV Foundation has made health visits with many partners across the U.S. HBF advocacies also improves patient care and access. It works to improve patient care to various HBV treatments. And in 2020, it co-hosted an externally led patient-focused drug development meeting with the Food and Drug Administrations. This final report will likely serve as a blueprint for the future trials of HBV therapeutics from the patient's perspectives. The HB Foundation has also led the effort against social injustice facing those with HBV by blowing the whistle on HBV-related discrimination. Most importantly, from the work of HBV Foundation, in 2013, HBV became a condition protected under American Disability Act. It is an important step to ending stigma and discrimination against HBV-infected persons seeking education and employment. HB Foundation's advocacy works to increase research funding at the national level. HBF's annual congressional visit advocating for specific report language during budget time has helped increase significantly the funding of NIH and DoD on HBV and HCC from 2015 to 2019. Its advocacy also works to increase public health funding. It helped the increase of CDC and HHS funding in 2019 by prioritizing funding for public health measures to eliminate HBV. In addition to advocacy, HBF has also been at the forefront of HBV research. It opened a research center in 2003 and renamed to the Baruch Blumberg Institute in 2013. The Blumberg Institute has the largest concentration of a nonprofit basic scientists conducting translational research on HBV and liver cancer. It contributed many discoveries that will likely help the development of a curative therapy for hepatitis B. Each year, the Hepatitis B Foundation awards the Blumberg Prize to an outstanding individual who has significantly advanced the science and medicine for hepatitis B. This photo montage highlights the AASLD, many of the AASLD members who have been the awardee of this particular prize. HB Foundation also keeps the focus on international HBV science. In 2005, it assumed the management of the annual international HBV meeting that rotates between Asia, Europe, and North America. This meeting was started in 1985 by Drs. Harold Varmus and Jesse Summers. Today, it continues to be the premier basic science meeting focusing on HBV. In 2017, I had the great pleasure to organize this international meeting in Washington, D.C. together with Dr. Anna Kramis of South Africa. There have been many congratulatory remarks to Tim and Joan, and let me just quote one from Harvey Alter. Joan and Tim have been the relatively unsung hero in the battle against hepatitis B. It is wonderful that AASLD has now chosen to sing their heroism. Joan, the heart and soul of the HBF, has endeared herself to patients and healthcare workers and has put patients' hepatitis B into public and government consciousness. She has given patients and their family hope for a better future, and Tim has worked on therapeutics to make that hope real. Together, they have built the Hepatitis B Foundation from a random thought to a major international entity serving innumerable carriers of hepatitis B infections and their families. Finally, I want to close with two quotes on advocacy, one for the young people in the audience who may be searching for a cause. The best way to find yourself is to lose yourself in the service of others, by Gandhi. The other for all of us, especially in this tumultuous time we live in today. No voice is too soft when that voice speaks for others, by Jenna Kachala. Now, it is particularly a great pleasure for me, on behalf of the AASLD, to present this Distinguished Advocacy Service Award to my longtime friends, colleagues, and partners in crime, Joan and Tim Block in the Hepatitis B Foundations, for their dedication and efforts in combating the disease that we all are passionate about.
Firstly, we want to thank the AASLD for this great honor, which we accept on behalf of the Hepatitis B Foundation, and for people such as Dr. Sherry Cohn, who's our Senior Vice President and now leading the foundation with its many programs. When Joan and I and Jan and Paul Woody started the Hepatitis B Foundation 30 years ago, our goal was to find a cure for chronic hepatitis B and liver cancer and to help people who have the disease. Of course, that goal is only possible with and because of you and the members of the AASLD. We are here for and depend upon you. So that's why this recognition means so much to us. That this award is presented to us by Dr. Jake Liang, an inspirational figure in the field, makes it all the more meaningful. Thank you again, Dr. Liang. We are humbled and further motivated to work even harder.
And I'd like to echo what Tim just said. I'd also like to thank the AASLD and Dr. Liang for this award. We are really thrilled to have this public recognition of the mission of the Hepatitis B Foundation. I'd also like to dedicate this award to the more than 250 million people living with chronic hepatitis B worldwide, and I count myself as one of them. We sincerely appreciate the AASLD recognizing the people living with this deadly liver infection, and we thank all of those who have helped make the Hepatitis B Foundation. Thank you.